That's the whole other body. I think it's honest, and it's like this. It's like, well, it's From town, the first in the column, is that's the body. And then I'm. Right.
It's the river.
You want me to start or?
No, we can start off the record. So it's 5 p.m. Welcome, everyone. It's the Northern States Power Company, Wisconsin's application for authority to adjust electric and natural gas rates in docket 4220 UR 127. My name is Michael Newmark, the administrative law judge for the Public Service Commission. We're here in Eau Claire, the Memorial Library, as well as on Zoom, and we're here to take public comments in this case today. We have no one in attendance at the hearing room, but we do have one person joining us through Zoom. So we'll get to you, Thomas, in just a minute or so. I just wanted to explain a little bit about the process for your information. We're also live streaming the hearing on YouTube, and there'll be a recording on our YouTube channel of that. Plus, we're transcribing the comments. So the comments that you give will be transcribed and included in the official transcript for the case. And it's the official documents that the commission uses to make its decision on the application. Just so you know, the commission received the application some time ago, probably more like April, if I recall correctly. And it's been vetting the application. Also, parties to the case have intervened, and they've also presented evidence in the case, their analysis of the application as well. And I'm going to receive the party documentation on September 16th. We're going to hold the hearing on Zoom on that date for the parties and commission staff. So the documents I receive, as well as the transcript of that hearing, will be part of the record in the case. And like I mentioned here, the transcript of this session will be part of the record. Okay, got someone else here. Okay. Let's let this person join in, and I'm just gonna. It's taking a long time to get connected. Okay, well. No. Okay, so we have one more person joining us on Zoom, and welcome you to the public hearing session for the NSP rate case. Like I mentioned before, so I'm the administrative law judge for the Public Service Commission, and it's the commission that decides whether to approve, modify, or reject the application. And today we're taking comments from the public on that application that the commissioners will review before they make that decision. So we have no people in the hearing room, so I'm not going to go through the process of making a comment in the room, but whoever the people who joined Zoom, you're here and ready to speak. That's great. And I just wanted to also mention that we'll be receiving written comments up until September 15th. The information on how to do that's on our notice of hearing, and I'm displaying that on the screen share as well. So there's a link to our public comment webpage and also the mailing address for public comments in this docket. We just need to receive those by the 15th in order for me to provide those to the commissioners to read. So just a couple of things to note when you're making a comment. Just speak slowly and clearly, because we are transcribing what you say. We have a court reporter in the room who's typing every word. So if you could just be slow when you're not be slow, but to speak slowly, let's when you're making your comments, so we can get everything you want the commissioners to know. And besides that, we can get started. So let's do that. I don't think there's really much else to review. So what we'll do first is take Thomas, and I'm going to just adjust the screen a little bit. Just get you front and center for us. Okay, and I'll unmute you now too. There we go. Okay, great. So Thomas, first I'm going to swear you in. So raise your right hand. Do you swear or affirm to tell the truth, the whole truth, nothing but the truth?
Yes, I do.
Okay, and I'm going to play around with the microphone so I can hear you. Okay, so I'm just going to need you to spell your name for us because we don't have it in front of us in writing.
Thomas, Thomas, Burans, BURHANS.
Okay, great, thank you. So go ahead with your comment. Give us your opinion on the application, please.
Okay, this is my story. My house runs hot. I'm scared to turn on my air conditioner up too high. My electric bill last year was over $4,000. I'm on a payment plan to pay it off, and every month I'm scared the electric company will turn my lights out. I'm unable to work due to a back injury. Thankfully, America is a caring nation, and people like me who can't work and any longer receive disability insurance. It helps me cover my rent and basic needs. My COPD means I often need a machine to breathe properly, which requires electricity. It is not an exaggeration to say that I need energy in my home in order to survive. In fact, my doctor has written letters to the utility company saying that I need electricity in order to maintain my life. If my provider turns my power off, I could die. Each year, it gets more and more difficult to keep up with my bill, which has gone up by almost $20 a month since last year. I've had to sacrifice other essentials, including food, medication, in order to keep paying my electric bill. It's not just utilities. The cost of everything in Wisconsin has increased. The rent, to groceries, to clothes. A recent study shows that a single adult in Wisconsin needs to earn $87,194 a year to live comfortably. That is up from $84,115 in 2024. And most of us are not making $87,000 per year. In fact, the average median income in Wisconsin is only $75,670, meaning more than half of Wisconsin residents are well below the income level needed to live comfortably. When I heard that the energy provider Xcel Energy wants to raise electricity rates in Wisconsin by over 11% in 2026 and over 7% in 2027, I was outraged. I already pay Xcel thousands of dollars per year. It's already hard for me and so many Wisconsin residents just like me to keep up with our bills, and now they want more. How are people like me on fixed incomes supposed to cover the massive increase? Even more, I found out that the CEO of Xcel Energy makes $6,200 per hour. He makes more in a single day than many Wisconsin residents make in a year. Xcel Energy reported over $8 billion in gross profits in 2024, and that is a major increase from 2023. Xcel is the CEO are doing just fine. They don't need to take more from Wisconsin families who don't have any more to give. Excuse me. Xcel proposed rate hikes would increase by my bill by an extra $16 per month, which may not seem a lot to someone making $6,200 an hour, but is a lot for someone like me. And Xcel isn't the only provider looking to raise rates. Alliance and Madison Gas and Electric are also all across the state. I wish the leaders of the and the CEOs of these companies could spend, excuse me, a month in with my income or walk a day in my shoes. They don't have to choose between their food and their medicine and the way I have. I think these CEOs knew what life really looks like. For the average Wisconsin family, they would think twice about these great increases. The increase will only make matters worse. It will deny people warmth in the winter or cool air in the summer because they can no longer afford it. In a humane America and Wisconsin, corporations that make billions in profit and CEOs who are paid several thousands of dollars shouldn't be allowed to take more and more from those of us who already don't live
Oh, just take a
comfortably.
break. Take a break. I don't know if we got the last sentence. Yeah, I understand you having some trouble.
Yeah, it's my COPD.
Okay, can you repeat the last sentence you were saying about
The CEOs
yeah, that in
are paid several thousands of dollars. Shouldn't be allowed to take more and more from those of us who already don't live comfortably. The Wisconsin Public Service Commission has the power to block these rates increases. We all want to remain in our homes, have extra money for food and medication, and not face homelessness due to higher energy bills. I don't deserve that. Wisconsin don't deserve that. What we clearly deserve is no rate hikes. Thank you.
okay. Thank you, sir. I just had a question for you. Is the account that you have with NSPW in your name?
Yes.
Okay, so we do have your name on file. Just gonna see if and is your health condition, you said your doctor sent a letter to NSPW.
Right. For the
So
past, excuse me, for the past 3 years. That's why it became my bill became $4,000 over the last 3 years. And every week I get a pink slip, which means disconnection notice for them to disconnect my electricity. Well, my electricity runs my machine for my COPD. So it's very difficult for me to make choices. I'm doing the best I can. I'm paying them as much as I can every month. And my bill still doesn't seem to go down. I've gotten it down by maybe $1,000. I can, I got, matter of fact, I have a bill right here. And I'll tell you the exact amount that I owe. And they want me to pay that right now. Excuse me for 1 second. I owe them $3,505.39. And that was
okay.
issued on the 27th.
So just curious, have you ever been disconnected since the letter of your medical condition was sent to the utility?
Yes, I have. But I was able to get it turned on the very next day because my doctor, this stupid phone. My
I'm sorry.
doctor them a letter saying that I need my electricity for my machine.
And you were reconnected at that time.
Yes.
Okay, good. Okay, well, thanks very much for that info. I'm glad we have your name and your story. And the commissioners will review that.
Thank you for listening, and I hope that the COPD or the COPD. I'm hoping that you can stop this increase. It means a lot to a lot of people. Just to have that breath of fresh air. I can't seem to get.
Okay, well, thanks very much. We're gonna move to the next person who's waiting to give a comment, but I appreciate your time.
Okay, thank you.
So I'm gonna mute you and turn off your video, but you'll still stay on the line and continue to observe the hearing. Okay, so I think the next person, I'm gonna try to do this in the order that I've seen people join because I was able to pay attention to that this time. So we have Abby Novinska. I think you're next. So I'm gonna unmute you. Are you unmuted? Okay, great. So let me swear you in. Raise your right hand. Do you swear or affirm tell the truth, the whole truth, and nothing but the truth?
I swear to do so.
Okay, let me spotlight you.
And do you need me to spell my full name?
Why don't you do that? Yes, go ahead and do that, please.
Okay, ABBYNOVINSKA-LOIS.
Oh, perfect. All right.
Hello. Okay, great. Hello, my name is Abby Novinska-Lois. I'm a public health professional with Healthy Climate Wisconsin, which represents over 1,200 doctors, nurses, healthcare, and public health professionals in our state.
Okay,
We
let me
are-
interrupt you just for a sec.
Mhm.
Please slow down.
Okay.
Slow down with your comment. We have time to take your comment, but we need to record what you're saying. We have a court reporter typing what you're saying. So
Okay.
she needs to keep up with you. Okay.
We
All
are urging the Public Service Commission to reject the rate hikes and the profit margin hikes being sought after by Xcel Energy in order to protect the health of Wisconsin families. Families across the state, but especially in many of the areas where Xcel currently serves, such as the Eau Claire area, are struggling with a high cost of living and high energy bills. Every month, those families are faced with rising grocery, healthcare, rent, and/or childcare costs. Raising energy rates will force more families to decide whether they need to forego critical goods and services in order to pay for electricity, and that's directly linked to poor health outcomes for those families, especially children and those over 65. In fact, a 2021 study from public health researchers at the University of Michigan and the University of Kansas found that energy burden in the United States was so influential on premature mortality or early death and self-reported quality of life, that it was more impactful than housing, healthcare access, and food security on those factors. That means that our energy rates really impact our quality of life and our ability to live a thriving one. In the summer, we see that families in Wisconsin are choosing not to cool their homes during dangerous heat waves, and in winter, not to heat their home to as comfortable of levels, which risks both their physical and their mental health, just to save all that they can and squeeze out a little bit more on their utility bills. That's dangerous, and it sends people to the hospital and makes it harder for them to recover when they have other health conditions. It is ridiculous to consider an astronomical 19% rate increase over the next 2 years in electricity for families and raise the return on equity when Xcel posted a profit of billions and their CEO, Bob Frenzel, took home a net salary of $12 million in 2023. Xcel has a 9.8% return on equity right now, and they are asking for more when families are hurting. But if you just cross the border into Minnesota, Excel in Minnesota has a 9.25% return on equity for electricity. That shows that it's possible to lower that return from our Public Service Commission if they're willing to stand up. And they can do so without harming the market. To make matters worse, 318 million of this rate hike that Excel is asking for is due to polluting infrastructure like the Wheaton gas plant that makes communities sick. Particulate matter from that project will worsen asthma, COPD, and heart disease. With hospitals shutting down in that area, Wisconsinites shouldn't be forced to pay skyrocketing bills for a system that sends them to the hospital. I ask the Public Service Commission to please treat Wisconsinites fairly and consider what families are experiencing around the state. It's time to protect the Republic, and we need to start by rejecting this rate increase and a higher return on equity. Thank you.
All right, thank you very much. Just take a break for a second. We have Elizabeth White next. Did you want to give us a comment? You'll need to unmute and turn on your camera. Elizabeth White, any comment from you? There we go.
Yep, I'm here, and for some reason my camera cannot start because it's disabled by the host, is what it's telling me.
By the host. Okay, let me send you a message. That should be able to you should be able to click this now. Okay, great. All right, we got you there. Excellent. So I'm gonna put you on the screen, and yes, swear you in. Do you swear or affirm, tell the truth, the whole truth, nothing but the truth?
I do.
Okay, give us your name and comment.
My name is Elizabeth White. I am a physician. My name is spelled Elizabethwhite. Thank you for your attention to our comments today, and thank you for having us. I am a family medicine physician. I have family members who receive their energy from the Excel Energy in Western Wisconsin. I speak on the behalf of many patients that have come through my clinics. I work in a rural part of Wisconsin that share similar realities to patients within the Excel energy system. It is very heartbreaking to have conversations with patients, just like one of the commenters earlier today, who have COPD or respiratory conditions or any other chronic medical condition that requires medications just to go through their daily life, surviving. These medications are becoming more expensive. Housing costs are also becoming more expensive. Healthy, nutritious food is harder to access and also come with an increased cost. As all these costs rise collectively, our patients are having difficult decisions with which basic need do they fill with their limited income. I've had multiple conversations with many patients about which medications they should choose to buy that specific month based on what time of the year it is, based on which condition is the most life-threatening at the time. And it is heartbreaking. We cry together in rooms. We have these decisions to make, and nobody wants to be making these decisions, but it doesn't have to be this way. I ask you as the PSC to share empathy with the many people who are under these same circumstances, who are being asked to pour more of their fixed income into energy costs that just don't have to be this way. I'm asking you to reject rate increases and lower their return on equity margins so that you can fulfill your role as serving the public and the community and looking out for the greater good and placing people at the core of what we do. It's the oath that I've taken as entering into the medical profession, and it's the oath that you've taken as being the PSC. So I ask you to join forces and place profits not over people, and really think of people at the core of every decision you make. Thank you.
Thank you very much. So I think if you could stop, can you stop your video from your side? I think that may be what I might have done last time. If I stop you, then it doesn't, you can't turn it on next time. So there we go. Thanks. Next is Brittany Keys. So we'll do the same for you. You were on the screen before. There we go. Okay, excellent. So just need to unmute. Okay, you're all set. Great. Okay, I'll swear you know the score to speak slowly. So do you swear or affirm to tell the truth, the whole truth, nothing but the truth?
I do.
All right, go ahead.
Thank you. My name is Brittany Keys, Brittany. Keys, Keyes. And I want to thank the Public Service Commission staff for the opportunity to testify at the public hearing today. I am a physical therapist, then the Clean Air Policy Manager with Healthy Climate Wisconsin, and have a role in advocating for environmental justice across the state. And I want to highlight that energy burden is an issue of environmental justice. I want to ask that the Public Service Commission deny the rate increase and decrease the return on investment. So deny their request and to decrease the return on investment for shareholders. As a health professional, I have seen the harms of high energy burden, as well as the harms of climate change, in clinics as well as in the community. One of the big things that Excel is looking to recoup costs on is, as was previously stated, the Weston gas plant. So their continued investment in new fossil fuel infrastructure. And coming from a community that is overburdened with air pollution from a methane gas plant, that burden and health harm is felt very personally to my family and community. I want to share two case studies briefly of related harms to high energy rates as well as impacts of climate change and methane gas plants. The first individual is a retired male in his 70s that experienced a medical crisis and developed severe cardiac disease. Required a helicopter ride, survived numerous in-hospital cardiac arrest, and became a miracle to get out of the hospital and continue to be part of his family. Appreciating the extreme swings of weather, he's more vulnerable to the more frequent weather events associated with climate change, such as extreme heat and poor air quality. And unfortunately, during the time of extreme heat, he decided to keep his air conditioning off. This put him at extreme risk for health complications or potentially death. Unfortunately, the reason why he did this is because he's on a fixed income and he did not want to pay his utility more. And so these individuals are more than numbers. The patients that are experiencing these harms are family members, and that patient was my father. The second one is a 8-year-old who was biking out with her family biking and experienced heat illness, and because of that became more susceptible to respiratory illness. And given the fact that she lives within the fallout of a gas plant, is now requiring the use of inhalers and more susceptible again to illness. And again, that patient is my daughter. And so I just want to highlight that, again, the individuals impacted are more than numbers. They are family, they are community. And the Public Service Commission has a responsibility to protect us, our family, our community, and everyone in Wisconsin. And again, I would like to echo the request that they prioritize our people, prioritize people over the profits of these monopoly utilities, deny the rate increase, and deny the percent increase return for the investors. Thank you.
Okay, thank you very much. All right. So we have no new people in attendance on Zoom and no one in the hearing room other than the applicant and commission staff. It's now 5:30. We could probably go give another 10 minutes to see if people do show up to the hearing. So we'll take a recess until 20 to 6, which is 5:40 as well. So at this point, I'll turn the camera off and reconvene at 5:40. Thanks.
Thomas, your testimony was really powerful.
Here. Oh, there we go. Okay, let's get back on the record. It's 5:41, so we've been waiting for new people to give a comment in this case, and we have no one new connected to Zoom and no one new in the hearing room. So we're before we adjourn, let me just mention that we'll be accepting written comments up until September 15th. We just need to have those comments in hand at the commission by that date. And share that notice on the screen for you. File a written comment. You can go to our website or mail the comment to us, just displaying that on the screen share. But just so you know, we need to get that comment in hand by Monday. So this time we don't have any more comments to take at the hearing. So thanks very much for everyone for participating and coming out. That's all we're going to do for tonight. So we're adjourned. Take care.